All right. Well, welcome to the Missouri Healthy Schools Podcast Live. My name is Guy Danhoff, and tonight we have a very, very special podcast for you. As we're going to be talking about Show Me School Health. This is an amazing resource, and I'm going to be joined tonight by a guest of panels, and we're going to have Marjorie Cole's going to be here, Tammy Gillespie. Angie unfortunately could not make it, so in her place is going to be Eli Bruggeman. We're really excited to have Eli here, talk about stepping up in the last minute. And last but not least, we're going to bring in Debra Funk. And without further ado, all right, my name's Guy Danhoff, and I'll be your host over the next, let's say, 30 to 45 minutes. I'm really excited specifically about this podcast because there's been so many great things happening in Missouri, especially as I'm going to be talking about school nurses. So without further ado, let's get into the show. And see, we got the show. You like that? Show Me School Health. And I'm going to bring on the expert, the mastermind behind all of this. And she's no stranger, certainly, to the space of nursing. And that is our very own Marge Cole. Marjorie, how are you?
I am wonderful, Guy. Thank you for that introduction on a early evening. This is great. I'm just wonderful. And hello, folks. I am Marge Cole. I'm Missouri's state school nurse consultant. I usually say I am your school nurse consultant, but I know that this podcast will go further than Missouri, and so we're here to show you all about us and how great and our great school health services program.
Absolutely. So, Marge, what I really want to start with, I know we've got some live viewers. Want to say thank you for being our guest, certainly for viewing tonight. I just want to let you know throughout the live podcast, you'll have the ability to make comments if you type comments in, or if you want to ask any of our guests a question, just go to the comments right there in YouTube, and I'll have the ability to bring it on the screen. And you are live, so you can ask any question you want. You can certainly, also make any comment you want. And without further ado, Marge, why don't you start with why was this website needed?
This website it was designed for our school nurses in Missouri. We always say, without data, you're just another person with an opinion. And so
That's
our
good.
school nurses showed us with their data, and they said, okay, Marge, we'll show you. So we've been asking them about their school children and their school districts and where they worked and what they needed. And they've told us.
Yep.
And so we have the data. Do you want to show that slide now?
Yeah.
Okay.
Yeah. There we go.
Yeah, okay. So I can't see the slides today. But I will say probably the slide you're looking at right now is two slides, and one of them on the right-hand side, it shows the percentage, the size of our school districts.
Yes.
Okay. And so you can see that the majority of our school districts in Missouri are 1,000 students or less per school district. Now, folks, in Missouri, we have about 565 school districts,
Wow.
and many of them are 1,000 or less kids. I also know that we have about little almost 100 school districts that have around between 150 and zero, so 0 to 150 kids. So, and those schools, when I ask them, I can't wait. I always love to talk to our smallest school districts and all of our school districts. But they say, so March, it's just sometimes it's a little bit like Little House on the Prairie, and that you might have two grades together.
Yep.
But what a wonderful, unique way that is to learn too. Our state is so diverse, and so we have very large school districts that you can see on the left side, and you
Yep.
can see that on the right hand side we have smaller school districts, all of our school districts. But if you notice, click that slide again, and you'll see that 66% of our school districts um, are we're 98. Was it 97? I can't see, but it's
97. Yeah, it was 97.
90.
Yep.
97% of our school districts are 5,000 or less kids in K through 12. So that means a lot to me, because then you have to start thinking about how many school nurses, how many of us are in a school building. We know we know we have kids, and we know we have
Right.
teachers and everyone else, but sometimes we don't have as many school nurses, and they're key to helping our kids be in school and ready to learn.
And then our
So,
next slide is you're going to talk about the school nurse staffing in Missouri.
oh, so that's an interesting one. So now we know because they've told us, our wonderful school nurses tell us, and they tell us every year. So you can see on this one, the percentage of nurses that are RNs and the percentage of nurses that are LPNs.
Yep.
And then you can see there, those that are part-time or full-time.
Yeah, and obviously the biggest percentage is certainly the full-time RN,
Yes.
and then you have the full-time LPN. You want to maybe explain that difference to everyone?
Sure.
What
So
that
a
means?
registered professional nurse
Yeah.
is a licensed professional nurse, and she has attended a school, has attended and is licensed as a registered professional nurse by the Board of Nursing. Our licensed practical nurses are also licensed, and they are and they are nurses who work under the direction of an RN or or a medical professional.
Yeah.
And so we have two kinds of nurses in Missouri. Both are
Okay.
school nurses.
Yep. All right, now we're looking at the health staff positions, and this is where you get into your health aides, clerks,
Yeah.
certainly with the contact, and then you have your LPNs and RNs. And so, what does this slide mean to us?
Well, this slide means that this is us all together because
Okay.
so look at the unlicensed assistive personnel. We have health room aides who do a lot of our tasks, then and free up our RNs to do and LPNs to do other things. But we're all trained together, and we delegate and train our school health services staff. And that's one of the needs that we recognized right away is that our school nurses were saying, yes, Marge, we train and delegate to our LPNs and to our unlicensed assistive personnel. And so then my next question was, how do you feel about training others?
Yeah.
Are you comfortable with this? And so you'll hear that they said, no, Marge, not always. And no, we don't have a consistent way to document our trainings.
Gotcha. All right. And then talk to us about the survey population. On one hand, you got school districts that responded, and on the other hand, you had Missouri students that were represented. You want to talk to us about,
Yeah.
this slide?
Well, again, it just shows you, anyone in the world will tell you that when you have your surveys are representing the majority of your kids in any state,
Yep.
that's pretty significant. I
Yes.
think that last year, I think our surveys represented 97% of the children are represented in our surveys. That's, we all say every kid counts. And our nurses are showing us that.
That's exactly what that means. I don't know if anyone really
Mhm.
understands when you get into the surveys, but to have that that response rate is kind of unheard of, to be honest with you. To have 97% of Missouri students represented, that is a big, big number. And obviously, Marge, it helps on the planning side and certainly the resource side and all the things from all the conventions, conferences, meetings, Zoom meetings. I mean, you name it, to really help identify what the real needs are from having that level of representation.
And it's because our Missouri school nurses tell us their
Yeah.
stories, God.
Yeah. And we want to tell more of that tonight because we're going to bring on some folks in just a little bit. So just sit tight. But we got some
Okay.
more fun stuff coming. All right. On your next slide, this one, I'll be honest with you, Marge, this is the one that I thought was pretty amazing because, when we talk about the role of a school nurse, it may have been thought of, and I'm just saying this back in my day, okay? So I'm going to go way back. I just celebrated my 40th high school reunion just like 3 weeks ago, okay? So I'm old. Okay,
Congratulations.
that's all it means is that I'm old. But what I'm saying is like back then, it seemed like, it was more like, hey, do you have a cold or flu or something basic? What this is saying, I mean, when you look at the percentage,
Mhm.
March, they're talking about asthma, life-threatening allergies, seizure disorder, type 1 diabetes, and now type 2 diabetes. Why don't you talk a little bit more to this information? Because this data, to me, is very revealing.
It is revealing, and it shows the number of children with chronic health conditions that are coming to school every day with the potential for a life-threatening event at school. And it's a chronic health condition they're going to have the rest of their lives. So just as we're going to teach that child how to read, write, and do arithmetic, we also have to teach them and support them as they are managing that chronic health condition and staying alive. So, there's some of these things, a very, very low blood sugar, or eating a peanut if you have a peanut allergy,
Yep.
or having a seizure that lasts more than 5 minutes, then you have to go to the emergency room. All of these things are very serious, but they can all be managed. We can teach our kids, and we can teach our school nurses, and we can teach our teachers how to manage these health conditions so that all kids are at school every day, all day learning.
At,
On that se-
yep, keep
on
going.
that same page, Guy, just look over on the right-hand side. Now, I put the link in there so that anyone can go to that link and see it big and can always see our data. So there's a link on that slide that will take our viewers to our
Yeah.
Missouri website. But please note, one of the things that hurts my heart the most, and then also makes me proud. Last year, 13 kids were attending our schools in Missouri that had a do not attempt resuscitation. So they were
Interesting.
very fragile kids, but they are welcomed into school and
Yeah.
supported in school. Um, and then what you're going to hear a lot from us is that our other big aha moment is the number of medical procedures we're doing in schools. So, our school nurses said, Marge, you've taught me about asthma, you've taught me about diabetes. I've got it. But
Right.
we still have the same kinds of procedures that Marge we do in hospitals, and we're doing them in schools. And I need more help with that. So you'll see that we have a lot of kids that have tracheostomies and ileostomies. We have kids that we're suctioning. We have kids that are incontinent. There's a lot of procedures and healthcare procedures that we're also doing in our schools now.
Wow. And I'm going to put this up for everyone. So this is actually to the link of that slide. So I have that up for you. That way it's bigger, Marge.
Yeah.
Yeah, it's bigger. But I'm also going to put up the Show Me Health. So if you want to go to the website, which we're going to be showing you in just a second, there's
Yeah.
that website too. That's the showmeschoolhealth.org website, which we'll be bringing on Tammy Gillespie in just a few minutes, as she's going to give us a live tutorial of the website. So we have that up there. And then, Marge, we just have one last slide for you. And this one has lots of information on it. And this happens to do with the staffing. And anything you want to point out about the staffing on the state of Missouri?
Okay, I'm sorry, I'm not remembering which slide I put in there. So, but I think it probably is just talking more about the number of our staff, the number of
Yes.
RNs, LPNs, and their educational preparation.
Okay.
And yeah, so that's more about what that one is. And what we're going to be so pleased does is that you notice on that one, I think we have 97 nationally certified school nurses in Missouri. That was last year.
Yeah.
And we understand that number has at least doubled for this coming year. Our data's not in for this year. Our school nurses have until October the 15th to turn in their data for this year, but I'm really excited, and we'd love to come back and feature our nationally certified school nurses. That's a really big deal. There's a 67% pass rate for that exam. It's a very rigorous exam, and I'm very proud of our Missouri nurses that have taken that exam and passed.
That is absolutely awesome. And so, Marge, we're going to make a transition now and
Yeah.
talk to us about, the impact that Tammy Gillespie's been having, and talk to us about Tammy. And certainly what she's going to do is she's going to actually do a live demonstration on the resource itself, which is the website.
So, Guy, we know because of our data, we know many of our problems. We know some of our
Right.
problems. We have the bird's eye view because
Yep.
our school nurses have told us.
Yep.
So, but when we dug down into that, so when you dig down into that data and you start looking at those things and those children, and then we also had our content experts, our school nurses. We have some wonderful Missouri school nurses in Missouri. And we started asking them questions, And we were able to find some funding through the COVID funding for infrastructure development. And they said, Marge, what do you want?
Yep.
And I said, I want every school nurse to have available to her the resources she needs just in time. When
Wow.
she needs it, not when Marge wants her to learn it,
Right.
not when she
Right.
can get into her car and come to Missouri, come to Columbia or St. Louis or Kansas City. I think she and her children and the students she serves deserves to know what she needs to know when she needs to know it. And this website does that, Guy. I am so excited about it. So but I need to give you time to ask Tammy and the University of Missouri Columbia
Yeah.
how they went about making this website for us.
All right. Well, without further ado, let's bring on Tammy Gillespie. Tammy, welcome to the show. We're live, and let everyone know that you are the MU Instructional Developer, Continuing Education for Health Professions.
Right.
So, Tammy, that's a big fancy title, but what does that really mean, and what do you do?
Well, I am Tammy Gillespie, and I've worked for MU Extension for 22 years. And so, in my current role, I'm an instructional developer. So that means that I get to support the great work of different state agencies, different departments from MU Healthcare, and different associations. Because the unit that I work for, which is the continuing ed for
Right.
health professions,
Yep.
we have the ability to provide continuing medical education credits to physicians, contact hours to nurses, and other similar contact hours for allied health professions. So, um, I told this story before. My mother was a nurse for 36 years, and my first job, paid job, was polishing her white shoes with shoe polish for like a nickel every week. And so, my heart is in. I'm not a nurse, obviously, but I love supporting nurses. It's an honor to my mom, but
Yeah.
also I just am amazed because school nurses do not just take care of tummy aches and cramps. They
Right.
are,
Right.
and through this process of partnering with Marge and the other subject matter experts, I have learned the really important work that school nurses and the unlicensed assistive personnel, what they're doing to keep
Yeah.
our kids, safe, healthy, and especially in those rural areas that she was talking about,
Right.
because what I've learned is they may be the only healthcare or preventative type
Yep.
healthcare that a lot
Right.
of these kids are getting. So anyway, yeah, it's great work. I love it, and I'm excited to show you guys.
Well, why don't you
Yeah,
show us, because we are
yeah,
the show me state. So the first question
right,
I have for
right,
you is, how do we serve school nurses?
yeah. Well, we serve school nurses by providing accessible, evidence based resources in a variety of ways.
Mhm.
Most of them are posted on this website, but we also have some resources that are in online courses. So, anyway,
And there's the website for everyone, once again,
yep,
depending on when you may be watching this, but it's right there. And then with that, Tammy, you want to go ahead and then just pull up
sure.
the
Yeah,
site,
yep,
and then you can navigate live and show us what you want to show us.
sure. Yep.
Okay, very cool.
So, the first thing I'm going to show you is the website, showmeschoolhealth.org.
Here we go.
And so, you got it?
Yes, there you
So there is a lot to see here, and Marge and Deb Funk and Eli, they understand the needs of the students, the health needs, both behavioral and physical. The one thing that I understand really well is how frustrating it can be when I go to a website. I've been told, "Oh, it's a great website. It's full of resources," and I go there usually with limited amount of time, and I can't find what I need. So, what I'm going to share with you guys tonight is a few tips and pointers on how you can quickly find what you need and, uh, go about getting what you need so you can help the students. So, anyway, I suggest that when you go to our website, you start out with the About uh, link, and I'm going to scroll down a little bit and show you this little paragraph here called Show Me School Health has a link in it, and it says Show Me School Health flyer. And that is a front back 2-page flyer. So if nothing else tonight, or if you've got cheer for your kids' soccer game while you're watching this on your phone, I want you to at least download
Yeah.
that flyer. So I have it up on the screen now. Does that look good, Guy?
Looks great. Yeah, it looks
Okay,
perfect.
all right. So the Show Me School Health website, it has 4 categories of resources on it. And so starting over on the left-hand side, this is just a listing of 150, actually, I think it's more than 200 now, just general resources, things like best practice nutrition policies for celebrating birthdays at school, for example, in light of kids' allergies. We have toolkits that help schools create policies for asthma and how to handle different situations. So that's just your general website resource. The second column here is something that I'm really excited about. It's called Just in Time Learning. And those are 51 different health office procedures that have the steps, step by step instructions on how to carry out a health office procedure. And about half of them, more than half of them, have an instructional video that aligns perfectly with those written steps. And then finally, the third thing that is on each one of those just in time learning pages is a downloadable skills checklist. So if Guy, you are
Yep.
an RN in the district, and I am an aide in a elementary school, you might have me watch the video, read the instructions, and then you would download that skills checklist, and I would have to show you what I know. So it's an observation-based competency
That's
checklist. We would both
yeah.
sign it, we date it, you'd tuck it away in your documentation file,
Yeah.
and that would be a consistent way to have the same type of evidence-based procedure across our state. And I think Deb Funk's going to talk
Yeah.
briefly a little bit later about how important that documentation is for the training. So, the third column going over is something that we call the in depth resources. There are 13 of these, and that doesn't sound like a lot, but each one of these 13 in depth resources goes into about a dozen considerations that are really important for helping our kids, all students, um, be included in things like field trips and being helping schools and school districts be prepared for emergencies and things like that. So I'll show you one of these here in a moment, but basically there are health conditions that our Missouri school nurses told us are the ones that they really needed some more in-depth learning on. And so I'll show you those. And then finally, on the right-hand side of this 2-page flyer
Yep.
is a thing we call learning modules. These are free, self-paced learning modules that a person can access. And these are specific to Missouri, so that's pretty important. They were developed by school health associates out of Wisconsin, I believe, but they're Missouri-fied, and they've been reviewed and approved by Missouri experts. So that those are the 4 different types of web resources. So to support the work of the school nurses and the health staff. And then on the second page of this flyer, we have some really exciting information also. On In early July of this year, we launched 3 different free courses for school nurses. And again, Missouri specific information. On the left-hand side, we've got comprehensive school nursing, which is
Mhm.
based on the Janice Selectman book. And we've been told by many people is that they there are nurses that are taking that course specifically so that they can prepare for that national association or that national credentialing that
Right.
Marge was talking about.
Yep.
New school nurse orientation. We've had lots of feedback from the learners saying, I've been doing this for 7 years. I wish I would have had this then. It has hot off the press information that pertains to Missouri school nurses. So, including the fact that licensed medical professionals, including school nurses, can take testing and take a training so that they can do oral health reviews. now to help with the oral health of our students, which is really important and helps prevent absenteeism, which is important to school districts.
Yep.
Finally, on the right-hand side, everyone's favorite, puberty education for school nurses. That title's a little bit different, but it's actually helping school nurses have what they need to provide puberty education to
Yeah.
those upper elementary kids. So, um, anyway, yeah, so we got 3 courses, and I looked today, and we have 790 learners in these 3 courses,
Wow.
in the first 12 weeks. So you wanna say that Marge Cole and Deb Funk and all of the other nurse leaders that they partnered with, they
Yeah.
they know they know what the school nurses in Missouri need.
Yep.
So, it's obviously struck a chord. So the bottom of this flyer, and I will get to the website, shows you how to create a free account, a Canvas account, in order to access and enroll in any of those courses. And the thing that is really important about those 3 courses, not only is it free, but if a person chooses to receive contact hours, they
Yep.
may do so after completing it. So that's kind of the printable version of what is on
Mhm.
our website. So I am going to go back to a different screen.
Okay.
So can you guys see the uh, about page again? Can you see the website?
Not yet. You need to,
Okay,
yeah, share
share
it
it
with
again.
yeah,
Okay.
yeah.
I think I must have undone I apologize, must have undone the
Oh, you're
share
fine.
feature. So, okay, so I'm going to go back to the website.
Okay.
So you went to the about. I would say that regardless of what you are looking for, because there's a lot on this page, I would say start by clicking on resources. And then you'll see a new screen appear. I'm going to scroll down a little bit, and you see that we have 7 icons here that show different body systems: cardiovascular, digestive, emergency, endocrine, etc. So that's an easy visual way to find what you need. But I personally feel that the most streamlined way to find what you need is to just use the search box on the right hand side. And so I am going to see if I can type correctly here. I'm going to
Hmm.
type in the word transfer, because maybe we have a new health aide and we need to make sure that he or she safely transfers somebody from the wheelchair to the floor, or the wheelchair to the chair,
Yep.
etc. And so here you'll see these gold rectangles, I'll say. Everything that we have that has something to do with the word transfer comes up. This one person transfer between wheelchair and chair, is something that you can look at. And so here we have the title of the resource, and here we have instructions and considerations for what a person should know before doing that. We have the supplies that are needed, proper body mechanics. And because this is a just in time resource, we have a video. So I'm going to show that video. I'm going to expand my screen so you can see it.
Perfect.
And you should be able to uh, hear it as well. It's going to start here shortly.
One person transfer of a student who is wheelchair bound. Transfer from a wheelchair to a chair. Considerations. Each situation should be evaluated individually in collaboration with the student's family and healthcare provider to determine if this procedure is appropriate.
So, one thing I want to point out, I mentioned it earlier and really want to emphasize it. A primary goal of all of the resources that we put together for Show Me School Health, we want this to be accessible. So that means that we have closed captioning on everything that has video base to it, so that if somebody has, say, a hearing impairment, they still have access to this same information. So anyway, so that's an example of one of the instructional videos. So I am going to go to, um, excuse me, I'm going to go to, actually, I need to
So
minimize that. Sorry.
yeah, so Tammy, while you're doing that,
Uh-huh.
if you're watching live right now, if you want to ask us a question or if you have a comment, feel free to type it in the comments. We can bring it on this on
Okay.
the to the podcast live and we can address your questions or certainly read your comments. So if you have anything that you'd like to say to us, feel free because we are live and this is
Right.
what's great about being live. And with that,
Right.
Tammy, back to you.
Yes. And so again, this just-in-time resource has the instructions, like all 27 steps of them, the video that aligns, step by step, and then the magic in this whole thing, I believe. Well, here's the magic right here. We've got the reviewers who helped review this because without without them, we couldn't have done this. But at the bottom of each of these just-in-time resources or pages, we have something called a skill competency download. So again, this is what I was referring to earlier when I was saying if you're responsible for training somebody, um, this is this is something that you can use.
And Tammy,
So
could you
can you
just share
see
that
this one?
again? No, share it again so I can bring it up.
Okay, so you can't see that one. Okay.
Right.
So, do I need to go back to this one and say present?
Probably.
Okay, I will do that then. Window.
And
Okay, here
Tammy,
it is right
yeah,
here. Okay, so this is the competency
yep,
checklist.
there we go.
And so this is what you would use to document your training of whoever you're training to make sure that they know how to do it step by step. Again, it uh, aligns with the web page. It aligns with the video. So, and there are 50 plus just in time of resources. So that's what the just in time resource is. Um, so I'm going to go back to the video or
Okay.
back to the website, unless anybody has a question. Um, One of the resources that I wanted to show you also, again, and I went to this by going to resources, and I said a lot of people have found that typing a keyword is the easiest way to find something. However, there's an alternative way. If you want to, you can say, I want to go to one of those in depth resources, one of those 13 health conditions, serious issues that you want to take a deep dive on.
Wow.
Uh, So I'm going to look at colostomy, ileostomy. I think ileostomy was something that Marge mentioned earlier.
Yeah.
This just shows it's in the digestive system. Uh, it's an in depth resource. And then on this page, we have all these different things that are considerations that a school nurse would need to know. For example, so you have a child with an ileostomy. So, what do you need to know about the school environment? How you set things up? Guidelines. Another really interesting subtopic within this in-depth resource, legal issues. And these are legal issues as it relates to Missouri and also national. So um, really compelling information. And then this was one, I think I mentioned it briefly earlier, field trips. So how can we include everybody in our programming within the school district? It's pretty
Right.
scary having kids that are having seizures and kids that um, you know may have a tracheotomy, but these just in time resources and that I mentioned earlier, but then also these in-depth resources. They're really helpful, I think, for helping nurses kind of plan ahead, plan for their school year. So, um, so I'm going to stop sharing that one, and I'm going to take you all to the very last type of web resource that we have. I think it's the last one. So I'm going to reshare my screen again. Thanks for your patience, by the way. So, the last type of resource is a little bit more in depth than just the web resource, a little bit more in depth than the just in time, and a little bit more in depth than the in depth. So in-depth is the word apparently for the night on my part, I guess. Sorry about that.
You're good.
All right. So, say you need to or you want to learn a little bit more about 504 plans, because I hear those are a kind of a big deal that you need to know about. You can go to this website and you can go to that sortable menu and you can choose learning modules. And we have, I believe it's 8 learning modules, 8 different topics. And these are free, self-paced uh, learning opportunities, I'll say. And they average, well, the 504 plans last 50 minutes, delegation 70 minutes, FERPA, HIPAA. I mean, it kind of varies, but I think they average about 55 minutes. And you can start and stop them anytime. So the reality I understand is that you start to do something and a student comes in, or a parent or a guardian. And so you can start and stop these at any time. Now, the thing that you need to know about these learning modules is that they were developed for Missouri nurses by school health associates out of Wisconsin. They do sell an equivalent version for a cost from their website. And so they requested that we kind of password protect these learning modules, which of course we wanted to honor our partner's
Yeah.
request. And so in order to access the learning modules, what you need to do is follow these little steps here, A, B, C. Answer a few questions to access the modules, and then bookmark the page, and then contact our department if you have any questions. But basically, what you have to do to get the passwords is to click on the link, and maybe I shouldn't. I guess I can show the beginning of this.
Sure.
So what we're asking is 6, very minor questions. Are you affiliated with the school district in Missouri? And then the next page goes on to say, what is your name and what is your role? Um, and so, anyway, so you have to respond to 6 questions, and then boom, you get an email that tells you what the passwords are, and you also get the passwords. They show up on your screen. So that's how you get to the learning modules. And I am going to show you one of the modules. One of the modules now. So I'm going to make sure that I've got my screen showing, and I am going to put in, if it will.
We've got your screen.
Okay,
Yeah.
there we go.
There
All
you go.
right.
Yep.
So this, I've already logged into this page a jillion times. That's why it didn't ask me for the password.
Okay.
Password is 504, just so you know. So this is a learning module, an example of one, and you should be able to hear the sound on it also. So
Okay.
have you guys got the big black screen?
In this course, you will learn what a 504 plan is. We will review the Rehabilitation Act of 1973, the ADA Amendments Act of 2008, and the definition of a
And if you'll
disability.
note, I can stop
We
it
will
at any
review
time. I can pull up closed captioning,
Yep.
and I can go over here on the left-hand side and look at the resources that they've got linked, a glossary, and then back to the menu. So I can jump ahead.
504 plans are
It's
a
like,
formal
no,
plan.
I
Let's
want to know
begin by
about the
reviewing the
Rehab Act.
Rehabilitation Act, the Americans with Disabilities.
So you start and stop it. So anyway, this is an example of one of the learning modules. So again, average time of 55 minutes. There is no contact hour with these 8 learning modules,
Right.
but it is lightly password protected. And so we do ask that you fill out that form, the ABC, with those responding to 6 items, just so that we know who's using the resources. And also, like I said, we wanted to make sure that we were honoring our our partner's request. So the last thing that I want to show you all is is a place on our website where you can get to more advanced learning, I would say. And so I will go to,
So, Tammy, while you're
yes.
doing that, I want to bring
Hmm.
up we got our first comment, and here it
Oh,
is.
good. Okay.
And what
Hoping
is
I can
asked
answer.
is, wow, these are amazing resources. How do I share this podcast with my colleagues? Well, my colleague actually jumped the gun, and here it is from our own director here at Missouri Healthy Schools. Jimmy Hale says there will be a link available for replay. It actually goes out tomorrow, and we'll have that everywhere. We'll send out through Missouri Healthy Schools, through multiple, through our, Twitter's an easy way to get it, but we're going to be sending it out, and that replay will be made available tomorrow. And thank you for asking about the
Hmm.
podcast stuff to be shared. This is one of those types of podcasts we're actually going to repurpose. It's yeah, and exactly, and Jimmy, you're exactly right. This website is a big time game changer, which is why we really wanted to focus. This is why we've taken our time with this. That I know this is something Marge and her team and the experts have been working on for quite some time, and finally we've got to the place where, hey, let's make a podcast, and that's
Right.
why we're here tonight. And Tammy, I got to tell you, you're just doing a fantastic job navigating, going between screens.
Well, no, that's
Just for everyone to know, this is the very first time ever on any podcast, and I've been doing this for 3 years now, that we've given someone, just like with you, just you are literally, I'm not touching a thing. This is all you navigating. It's just real exciting, so that you can dig in, show us what we need to see. So this is kind of a first for us, even
hmm
being able to do it this way. But again, we want to be able to help serve these needs and make these resources
hmm
available. And we're going to be sharing a lot tomorrow
hmm
and over the next few days. So with that, I know that you want to share one more thing. So
One more thing, right?
yep,
And you know what? This is very satisfying to me, not only because I'm proud of it and I'm proud of the team that has done this, led by Marge, but you know, I did get in the weeds of a lot of details of uploading these resources and organizing them, and my hat goes off to school nurses everywhere, because
yeah,
by the time it's buccal gravity, button bolus, gravity this, and anyway, I was cross-eyed. I will say this, because I see that my our associate director asked a question, and it's reminding me, just since July 1st through September 30th,
yeah,
the website has had, just in that short amount of time, July was that quarter, 3 months, we had 7,837 users. Most of those were new, and there were about 1,300 resources that were downloaded. So I think that
wow,
that was probably those skills checklists, which really are important.
yeah,
And then, so the final thing that I'm going to show you,
yeah,
um, so if you go to our website, there are a couple things. One of the things I want to share with you, continuing education courses. And again, this is described in that 2-page flyer that I have posted a couple places. Um, so can you guys see it?
yeah. It looks great.
Okay. So anyway, I'm going to enlarge it. So there's that 2-page flyer again, but this is just a little description about these 3 free courses that can provide contact hours should a nurse decide that they want to, complete the course and verify their attendance and do a end of course evaluation. So new school nurse orientation, just that one has 5.25 nursing contact hours. Puberty education is shorter. And then comprehensive school nursing has up to 20 nursing contact hours. So, again, they're quite interactive. They're accessible with closed captioning and transcripts, and people are obviously loving them. And when we hit that 1,000 mark in about a month or so, if we
Yep.
stay on our same trajectory, we're going to have a show me school health party somewhere, Marge. Okay, I think that's all that I have. Again,
Wow.
it's an honor to support the work of school health nurses. I had no idea of the complexity of things they do. And Angie had told me, the current president of the Missouri Association of School Nurses,
Yeah.
she had shared with me, she's been nursing. I mean, she's the president of the Missouri Association of School Nurses, and she also is a member of the national organization. But she said she went to our website recently because it had been 6 or 9 years since she had had a student that had a G tube. Well, she did this year. So what did she
Wow.
do? She went to the website. So this is not just for novice new school nurses, I guess is what I'm saying. And so
Well,
I appreciate Marge listening to her people, It's
absolutely. And I have a question. We just had a comment come in, and Marge, or Tammy, either one. But here it is. Here's the question. Todd Winterbauer asked the question: is there anything like this in any other state? I'm assuming they're talking about this sort of resource. So, Marge, are there any other resources like to this level of robustness that is available in other states, or is this just a Missouri thing?
I don't know. Can you hear me now?
Yep.
Well, we think we're the first. We think we've
Okay.
shown the nation.
Okay. Well, there you have it. And obviously, we think that hopefully this podcast will create some more interest so more folks can start, looking to do this in other states as well. And again, we're here to share this with everyone. Obviously, contact any of our experts, and certainly Marge if you want more information on how this gets done, because there was so many moving pieces to this. And we're just really proud and just happy and just excited to be able to share this tonight. So thank you, Todd, for that question. And so with that, so Tammy, you want to talk to us, introduce our next guest?
Sure, sure. So one of the subject matter experts that Marge enlisted is a Deb Funk, and she is speaking of accessible, very accessible. And the two trainings that I helped with this last summer, Deb was there, and so really Marge knows her much better than I do, but she can speak on why this documentation is important to the professional field of school nursing.
Debra, welcome to the show.
Hey, thanks, Guy. Thank you very much. Glad to be here.
Yep.
Hey, it's really been a great opportunity for me and actually representing the Board of Nursing as well. I think a lot of the school nurses have heard me talk before about the fact that, we have a very broadly stated Nurse Practice Act. We don't have laundry lists in our Practice Act that tell us, everything nurses can and cannot do. And so, we really have to depend upon as a statement or a philosophy that the Board of Nursing has. And what they support is that every nurse's scope of practice is based upon their knowledge, their skill, their training, their competence, and that their continued competence must be documented. And of course, they have to keep in mind too that the Board of Nursing is probably going to be their least restrictive regulatory body out there. Just so happens though, when you're a school nurse, you don't have a whole lot of regulatory bodies out there. When you're in a hospital or you're in, long-term care facility, there's a lot of regulators that impact your practice. But that's not the case in the school. In the school, you as a nurse are really kind of a totally different element. You're in that school environment now. It's no longer HIPAA, it's FERPA. So it's really important that, school nurses really feel confident and comfortable in their practice. And what this program has allowed to occur is it has allowed nurses to be able to go out there and reinforce, those things that we all learned many, many years ago, perhaps, or it's things that maybe we haven't ever done before. And we needed that extra, educational process. It's also going to allow the nurses to be able to educate those individuals that they are delegating tasks to, because we have so many things that we provide care, different types of care for the kids in the schools, and the nurses are not going to be there to do it all. They're going to be delegating those tasks to people like, teachers and the cafeteria ladies, the school bus drivers, the coaches, all these different people who aren't nurses. And we're going to delegate to them these very important tasks in order for the kids to be able to have good care in school and be able to participate like any other child in the school setting. So it's really been exciting for me to be able to be part of this. I have been able to review some of the different sections I completed the new school nurse orientation. So
Congratulations.
I was pretty proud of myself for that.
Yeah.
You know, I feel like, the school nurses have been just wonderful to work with through the years. And Marge and I, we've worked together now for a long time, and we're kind of like, the dynamic duo. we show up, and I look at things from the regulatory standpoint. She looks at it from the practice standpoint, and we just put two and two together. So it's been a really great opportunity. We do have on the website here,
Yep.
showing our website. And when you go to the Board of Nursing's website, if you look on the left-hand side of the screen, you'll see where it says General Resources, and you'll click on the General Resources button. And then under that, you'll look at statutes and rules.
Okay.
And that's the Nurse Practice Act. That's going to show the laws and the regulations that impacts our practice. Many states are very prescriptive, and we just happen, we're not. And it's to our benefit that it's not, because it allows our profession to move, more freely and easily as changes occur, because after all, healthcare is very dynamic. So,
Right.
we're always changing. So it's been a great experience.
And so, Debra, just for viewers' sake, I'm going to put this up here, and this is exactly where they go to see this, correct?
Correct.
Okay. So you have it right there. It's the pr.mo.gov/nursing. And then you can get into the Missouri State Board of Nursing website, and then get into what Debra's been showing us. And that's, again, another great resource that is being showcased just from this resource itself. So, Debra, this is, again, just incredible work. And congratulations again on you actually going through the program yourself. It's exciting. Well, you know what? It just gives it validation. I mean, it does. So, and Marge, anything you want to comment on that?
No, other states are afraid of their Board of Nursing. In Missouri, our Board of Nursing is our friend. We go to them. When I first started working in Missouri as a school nurse, I kept thinking I was going to lose my license if I didn't do something. And
Right.
so we've made friends. We have a relationship. Our Board of Nursing is there to help us protect our kids.
Yeah.
And it's just a lot of fun. It's so much fun when state agencies and regulatory agencies work together.
Yep.
To help kids be safe.
Yep, that's right.
Absolutely. Yes. So, Marge, with that, we've talked about many perspectives, but there is still one remaining perspective we have not gotten from, and we're going to go to your favorite place, which is certainly on the front line with our nurses. And without further ado, let's bring on Eli. And Eli, first of all, welcome to the show.
Hey.
Just to give a little background here, I want everyone to know that Eli is coming on, and she, I think, probably found out maybe 7 hours ago that she was going to be on, because
a little less, but yeah.
So you made it on. But talk to us a little bit about your background, and then we'll get into the big question that I want to ask you.
Sure. So I currently serve as the Missouri Association of School Nurses president-elect. And, MASN, our mission is to provide leadership and promote professional growth to advance the practice of school nursing. And we are thrilled at MASN to be a part of this project and to be a leader in promoting it out to the school nurses in Missouri. This is a phenomenal way to grow in your professional knowledge and to advance your practice and to further be able to take care of those kids in our schools. So this resource is phenomenal. I mean, I can go on if there's something specific, that you want to get into, but, this website's amazing because it's literally a dedicated resource for school nurses. And, the fact that one of the educational program is called Just-in-Time Learning, that is named so appropriately because it's time. We don't have the time to dig through tons of resources, to look for unreliable, videos on the web. We need evidence-based information that we can move quickly on when we find out that we have a student coming in with a health condition that we haven't seen in 8 years. And as Marge said, a great part of Missouri's school nurses, the majority of our school nurses in Missouri, are working alone. And part of my personal mission as the president-elect of the Missouri Association of School Nurses is to get that message out to school nurses that you are never alone, never alone. But we practice on islands, and we go from building to building, and we're all over the district in a day maybe, and our administrators don't really know what we do, and the public doesn't really know what we do. And a resource like this can further school nurses in feeling less alone. And the thing about school nursing too is anything can happen at any time. It is a specialty practice of nursing. I would ask you, can you think of a nursing job in a hospital where you need to know something about everything and you don't know what's coming through the, other than an emergency room, right? I can't think of another specialty in nursing where you have to know everything about everything and it could walk through the door at any minute. So,
right.
If you think about how school nursing has changed and what we are doing and how we are helping kids to be able to attend school safely and confidently. Yep. 30, 40, 50 years ago, school nurses were not, dealing with the ostomies and the G-tubes, the tracheostomies, and catheters so children can urinate. And wound care, central lines. What we are doing in schools is likened to any multi-floor medical facility. So we at the Missouri Association of School Nurses are just so proud of this resource. We're so thrilled to partner with Marge and you on it, and it's just amazing. So we're thrilled about this, and this is a real-time resource. I could give you like many examples, like Tammy said, with our president Angie and getting a student with a G-tube. That happens to me. We had a student who was having ongoing medical complications, health complications, and they finally reached a diagnosis, and I was told within the week the student was going to be in my school with a G-tube and feedings through that tube on a pump twice a day and 3 flushes a day, and also an ileostomy, and that needed care 3 times a day. And I was like, I can do that. And I told the students, I will do and I will learn whatever I need to so that we can give your child the opportunity to stay in school. I said, give me a crack at it. Like we talked about home, education at home, and did he need a one-on-one nurse? And I said, no, we can do this. But this resource didn't exist.
Right.
So hours of research on my end. And when I look at like the ileostomy and the colostomy page on the Show Me School Health site, there are things on there that I still am like, I should have done that, or I should have thought of that. Or you just, in school nursing, you don't know what you don't know. And a website like this is fantastic. It's fantastic. It's fast, it's quick, it's concise, it's live links. And you know what? It's evidence, it's an evidence-based infrastructure, and all the material was reviewed by Missouri Association of School Nurses, right? So we are thrilled to stand behind this. It's phenomenal.
So Eli, let's just take it one step further, okay? I know you're talking in your role of certainly being on the front line, being a school nurse, but let's tap into now being the president-elect. Obviously, you're working with Angie. From an advocacy standpoint, if you could share what you plan to do, what the Missouri Association of School Nurses plans to do moving forward with this resource to advocate and get this word out even at a grander scale.
Right. We certainly need to promote it, right? We need to do whatever we can do to get this in front of school nurses. We need to push it out possibly through conferences, through the website, through just spreading the word. We put out a quarterly newsletter. Angie and I are available to anybody who has any question, any nurse, school nurse who has any questions about how to access this material. But the plan is definitely to push it out, because I'm telling you, there's just stuff in here in this website that I said you just don't know what you don't know, and it's just one of the programs in here is the school nurse orientation program. That's phenomenal. A new school nurse, we need to push that out, through those conferences where we welcome new nurses into the practice.
Right.
So the Missouri Association of School Nurses is just thrilled about it, and we'll do whatever it takes to push it out and make sure the state knows about it.
That's awesome, Eli. And all I can tell you is, as far as Missouri Healthy Schools goes, as you begin to push this out with Marge's help as well, of course, we're going to help you do that. We're definitely going to help you do that through as much media as we can, and all the things that we're involved in, because this is a story that definitely needs to be told. But the best part is this was made up and reviewed by school nurses on the front line. Exactly. And it doesn't get any better than that, because like you said, everyone has all these different experiences. You got different size school districts. There's all kinds of unique problems that, come up. And to have this resource now is phenomenal. But I can just tell you, as far as Missouri Healthy Schools goes, we're going to help you in in that advocacy campaign as we move forward. Tammy, I know you said something to me a little while ago, and I want you kind of to camp on that a little bit, another perspective as to, again, how this resource also helps our front line.
Right. I'm passionate about this.
Yeah.
And I'll just try to be succinct. I feel like the Show Me School Health program is Marge's hug to all school health office staff, including school nurses, because this is not just, ultimately, yes, we want children to grow up healthy and being included in their communities, whether they're urban or rural. But this is also about caring for our school nurses. We don't want them to feel like they're on an island. We hope that this resource provides them with what they need so that they're not isolated, they don't feel burnt out, and they don't leave the profession. Because frankly, we don't need more school nurses leaving. We want more, and we want to better prepare the school nurses that are coming out of nursing schools. We want to equip them, in their own time, in their own, conveniently. We want to prepare them with the new school nurse orientation, and also provide opportunities for those existing school nurses to maybe take the comprehensive school nursing course so that they can prepare for the national certification. So we're really looking at this also as care for the nurses individually, and also for growing and sustaining the practice within Missouri. So it's been wonderful. So
that comprehensive school nursing program is just a phenomenal idea, and such a great prep for national certification. With national certification, you continue to promote and develop that professional development, and you keep learning. And it's the fact that there's a class within this framework to help prepare for national certification.
Absolutely.
Which is just exploding in Missouri. More and more school nurses are getting certified. And it's so important. So, and who doesn't like free try to find free contact hours for nursing. It's so hard. It's so hard. And it's right here. So that's like a side note, right? You can get some contact hours. It's just so well thought out. They've just thought of everything.
Well, it took us a long time to think about it. We've been thinking about it, and
I can tell.
Yeah.
Yeah.
But the other thing is we nurses talk in acronyms, and so SOS to us means share other stuff. So the Missouri Association of School Nurses, they've tooted their horn pretty broadly, and I know that Angie shared with all of the presidents of all the other state organizations about our website.
Yeah.
And that's the nice thing. Our website is really open to every school nurse. It's Missourified, but anybody can join our website and learn with us, we Missouri school nurses, Tammy totals that for us and tells me all the time. I think this week you were helping somebody from New Hampshire or somewhere get onto the website. So, Guy, we know it's ours. It's our secret sauce, but we're sharing it.
Right.
No, absolutely. And Marge, that's what this is about. I mean, like I said, we're just trying to seriously make this impact here in the United States. We hope other states want to talk to us. We hope that we can all just make sure. And you like what you said, the goal is to get and keeps kids in school.
Yeah.
We're trying to be proactive. This is why these resources even exist. The fact that the amount of planning that went into this, the resource development, having someone like Tammy explain it to us, right? Tammy did a great job in a short amount of time. And by the way, you were live. No pressure there, right? Yeah, you're live showing us on a podcast. I mean, it's unheard of to think we could even do that. But that's the point. And Eli, you know, your point about just every day, you don't know what can possibly happen. Now you have a resource. If something happens, you can go to really quickly, get a quick refresher, whatever you're going to need. Right. It's there at your fingertips.
Yeah, it's evidence-based, developed by nurses, for nurses. What more? What more do you need? It's
phenomenal. So what I'm going to do is just recap really quickly on the websites. First and foremost, here's the main website. It's the showmeschoolhealth.org website. Obviously, one thing I will say that we are going to do, Tammy, we'll probably take this podcast, split out your demonstration part as kind of like a separate, piece of content here, so that if they want to get more granular, like you showed, we can do that. Obviously, we'll have this full podcast in tech like is, but we'll probably end up doing that just because you're going through, the navigation buttons and they can see some of the highlights. Yeah. And then, Debra, let's bring you on for this. You want to talk about this again? Why we want this, resource?
Well, because it's so important for our school nurses to understand, the fact that these resources have been developed specifically for Missouri nurses. So you can feel comfortable that, you're not going to learn something here that is not permitted to be done in the state of Missouri. It's with Missouri legalese, if you will, exactly. So there's absolutely nothing to be worried about as far as using these resources, and they are resources. They're not mandates. They're not laws. It's all there for everyone to be able to utilize.
Yeah. And then just let everyone know, at Missouri Healthy Schools, we have our website. I'm just going to just say it like it is. This is a fantastic resource. If you want to see past podcasts, there's just so much you can navigate from so many different resources, including the CDC. But this is a great place to go as well. Obviously, every time that we do a podcast, we make those links available. We also talk about our upcoming podcasts. And so, again, we've always got our Missouri Healthy Schools podcast there. And obviously, we have our share of resources, again, for certainly school nurses. And so what I'd like to do at this time is just to thank everyone, certainly to thank our audience for tuning in. I want to thank you also for asking some of the questions. And all I can say is what an amazing panel. Thank you all for being on tonight. Marge, you got a lot of good friends supporting you here. It's so fun getting to do this with you. And Marge, it'd only be fitting as I wrap up the broadcast, if you could maybe put it in perspective and kind of give us a final word.
Well, the final word is partnerships.
Yeah.
And the Missouri Healthy Schools and CDC began this work with me. CDC, you taught me everything I know. You made me know that I had to be evidence-based and evidence-informed. And then my Missouri school nurses hold me to a very high standard. They want the best, and I'm damn sure they're going to get it. And then I found my dearest colleagues at the University of Missouri Columbia. I could not. Todd Wittenbauer and Tammy Gillespie and Dr. Meyer. That team brought everything together for us. And every time I said, "This is what I'd like to have," or "What is it?" they used to say, "Well, Marge's dream." and it's became Marge's dream. But folks, my dream is that all kids are healthy and happy and learning.
Yes.
And I think that's the closing thing is here in my office, it says children are the hope for our future.
Yep.
And we're the hope for theirs.
Absolutely. And just want to end with this. Natalie Botkin says this, great job. So excited to continue to share this resource with our school nurses. Natalie, absolutely. Thank you for making that comment. Marge, way to wrap it up. You know, I have to give you so much credit because I can remember when we'd be talking about this whole concept of podcast and, you know, you knew that we were going to, I know, right? Here she goes. You're like, no, I don't want to do about this. Yeah. And Marge, but here's the deal, right? It just goes to show that you love and care so much for not only, you know, our school nurses, but ultimately for the students. You're on the podcast so that we can share that story. I know it maybe took you, you know, a few ways of trying to get onto the podcast, 2 different ways, but you are here.
She's no quitter.
She's no quitter, so you're here. But Marge, no, seriously though, it just goes to show that we want to leverage every piece of communication that we have, every piece of technology. We've been very blessed, like you said. I say the same thing about the CDC. We're able to do what we're doing here in Missouri because the CDC supports us. They're listening to us. We're sharing ideas once a month, at least on the meetings that I'm in from communications. Mm-hmm. And these nights happen simply because, you know what, we're advancing the profession. We're advancing, you know, the work that needs to be done. And Marge, seriously, just thank you for just, you know, being the catalyst to get this thing in motion. And then, of course, everyone that's on this call. And of course, there's many other people behind the scenes that have really made this website happen. We couldn't be happier. And Marge, seriously, just, and I mean this, I'm just so glad that you were on tonight because I know you were struggling just to log in. But it's just great. It is. This was such a fun podcast for me. So unique from the standpoint of like Tammy's going live. Are you kidding me? Showing all those resources. We've never done that before. But it just goes to show we have the technology. And Eli, to your point, we've got to get the word out. That's why we're doing this tonight. So all I can say, folks, if you want to get in touch with these folks, you know, here's their names. And feel free to reach out to anyone. Of course, you can also reach out to us. And we got one last one here. Here we go. Sarah types and says, Missouri is lucky to have all these professionals working so hard to keep school nurses informed, educated, and up to date. Sarah, I'm going to give you a double thumbs up on that one.
Yeah.
Exactly. Eli, to beat me to it, she's got the heart going. Yeah, exactly. Very good. Well, thank you, Sarah. And I just want to thank everyone for tuning in tonight. Certainly feel free to watch the replay. And I'm pretty sure, though, that we will put out Tammy's section as a separate YouTube video simply because she's going into the nuts and bolts of some of the key things that are in it. And I just want to thank our guests, seriously. So for Tammy, Debra, Eli stepping up in the pinch, right? Yeah, she's there. Boom, this is what we do. We roll with it.
Great
and then,
job.
of course, Marge, again, just thank you so much. And just thank all you all for watching. And our next podcast we'll be announcing fairly shortly. So just keep attuned to our website as well as to our social media channels. We'll be announcing that as we'll have one coming up in probably about 4 to 5 weeks, as that's kind of our schedule that we're working on. But just thank you all again. And seriously, we all hope that you got something out of tonight's podcast. And again, we're all here together to lock arms, to serve, and to really make an impact on the kids, you know, at our schools. So thank you all for a great night. We'll see you on our next podcast coming up next month.
Bye. Thank you.
Thanks, Guy.
Yep.
Thank
Bye-bye.
you.
Thanks.